Hi, I'm Alison, the Unexpected Dietitian, and today I wanted to share something really exciting that's happening this week, which is that I have been working in the NHS for 30 years and I just cannot believe it. So, a few things have changed over those 30 years, and those are the things that I wanted to share. So, my first job was at Barnsley District General Hospital, which was a lovely little hospital and probably still is a lovely little hospital. And in that job, I covered wards and outpatients. Things I remember are that before I started, their uniform there was this little white dress, like a nurse's dress. It was quite see-through and quite short. Now, anyone that knows me knows that I am not the build for a short see-through white dress. I wasn't then, and I'm definitely not now. And I was so grateful when I was told just before I started that they'd changed over to white coats, like the doctors wore. And the advantage of the white coats was pockets. They had big pockets, so you could keep all of your equipment and stuff in there, which was fantastic. But they did get really grubby, and you did get mistaken for doctors quite often. The other thing I remember is we didn't really have computers. Everything was written on paper. When we did a presentation, it was on acetates that we used to write with a pen. And if you got it wrong, you had to start again. Or if you leant on it, you'd smudge it everywhere and have to start again. There was no images or nice graphics or fancy surveys. It was just words handwritten in my awful handwriting on a piece of acetate. And I remember when we were able to print out acetates on a dot matrix printer, and it was so exciting. And then when we got PowerPoint later on, we were able to use that. Other highlights I remember, or lowlights maybe, is going onto the ward one day and finding that a consultant had scribbled out the notes I'd written the day before about a patient. He didn't like them. There was nothing wrong with them. It was evidence-based medicine. He just didn't like it. And he got a black marker pen and he scribbled out my notes and he wrote, "This is rubbish," across them within the patient's notes. And I often wonder if those notes still exist somewhere in a vault, and what people might think of that. We couldn't get away with that these days, of course. We have computer records, so we can't alter other people's records anyway. But they are a legal record, and so that should never happen and should never have happened then. I also remember that we used to be able to prescribe alcohol on patient drug cards. So if you had, an elderly lady who liked a tipple of sherry of an evening, you could actually write alcohol and sherry on the drug card for them to have in the evening as an appetite stimulant. Again, not sure we'd get away with that so much now. I used to like to go down to the canteen and fetch cake or order a birthday cake for patients that had been in for a long time. Again, it's that flexibility that was so lovely in those early days. When I left Barnsley, I went to work in Sheffield, where I still work, because I've done quite a lot of jobs there. And when I first started working in Sheffield, in one of the departments, not the one I worked in, female staff were still not allowed to wear trousers. So that's what's changed in that 30 years, or 29 years to that job. Female staff had to wear skirts. We weren't allowed to talk in the office either, which is very different to now when we talk quite a lot. Appointment times were much shorter. We had like 20 minutes for a new patient and 10 or 15 minutes for a follow-up. We didn't have time to go into details of people's lives and history, the psychological barriers that they might have to making changes, or the things that really troubled them about their health and diet. It wasn't holistic care. It was a medical model. We assessed people quickly. We got a diet sheet out and we told people what to do and expected them to do it. Fortunately, all that has changed. We didn't study anything about psychology or, how to motivate people or encourage people to change at all. It was very basic in that sense. And, a lot of things have changed and a lot of things have changed for the better. Some things changed for the worse. So, it's nice to have the computers. That's great. I love working in a multidisciplinary team like I work in now, and having more time with patients I absolutely love, and I think I'm quite lucky in the team that I work in that I have that. But there's a lot more paperwork now in terms of computer paperwork, not written paperwork. There's a lot more rules now, a lot less flexibility to do what you want to do for the patient, and I kind of miss that side of things quite a lot. But I am really, really lucky in where I work now in Sheffield as a diabetes dietitian, in that I've got a great team around me, both the multidisciplinary team and dietitians, so I can get on and do the things that I really enjoy doing, which is seeing complex patients and working with teenagers and young people with their diabetes. I've had quite a few different jobs, even within working in Sheffield. So, when I first started there, I was a renal dietitian seeing kidney disease patients and a paediatric dietitian at the same time. And then I went on and did the cardiothoracics, orthopedics, medicine, care of the elderly, as well as doing outpatient clinics. And for 1 year, I had a secondment out of dietetics altogether, working in health promotion and community liaison, which was great education for me. I knew very little about the local community and I learnt loads. And that led me later to become a community dietitian in Sheffield, where I would do lots of public health work, going and trying to teach people in working men's clubs and community centres and nurseries and schools. Absolutely fantastic job it was then. And then from there I went to work in a weight management service. I didn't work as a dietitian in that service particularly. There were other dietitians there. I worked on the psychological side with a psychologist, looking at the things that make it difficult for people to manage their health. So things like food trauma, things like disordered eating as well. And at the same time as doing that job, I was also covering maternity leave in a specialist eating disorders service as well, with more acute eating disorders. When I left that, I came into diabetes. So I've been in diabetes since then, doing lots of things, including things like group education and one-to-one work. And now the biggest thing really in my job in diabetes is technology. Technology is absolutely taking over in diabetes, as anyone who works in it will know, from continuous glucose monitoring to pumps and hybrid closed loops. It's taking quite a lot to get my 30 years of dietetics brain clued into all the technology, but it really is fantastic for patients. So that's a little bit of a story of my career over 30 years and some of the things within it. And I hope you found that reasonably interesting, and it'd be lovely to hear what you think of that and what's happened in your careers if you're a dietitian watching this as well. Thanks a lot. Bye.